Good day, sir. My name is Kent Sibancheta, and here is my final exam. What is dental caries and how does it form? So, dental caries are commonly known as tooth decay, and it is one of the most common non-communicable diseases, and it progresses, and if it is not treated, this will result in tooth loss. Dental caries are defined as microbial disease of the hard tissue structure of the teeth that result in a local demineralization of the organic portion and destruction of the organic substance of the teeth. In short, caries cause damage by demineralization and dissolution of the tooth structure, wherein it results from having a high pH at the oral cavity. Also, tooth demineralization wherein the acid penetrates the organic substance. The higher the acidity, thus the demineralization. Caries is episodic with alternating phases of demineralization and remineralization. Dental caries are formed or develop over time. The loss of tooth substance of the enamel and the dentine is caused by the acid production, which result from having bacteria metabolism of sugars. When it comes to cavities, the main culprit here is the dental plaque. This sticky film of bacteria is continually forming on the teeth and feeds upon the sugars in the food that are being eaten and liquids that be drunk. The bacteria in the dental plaque releases the acids, and the stickiness of the dental that keep the acid in contact with the teeth, which damage the enamel through the loss of calcium and phosphate. This process is known to be demineralization, and it can be cause white spots to form on the tooth surface. These tiny openings in tooth enamel represents to be the first stage of cavities. And next question is, what are the three etiologic factors? There are three etiologic factors of dental caries, which are the tooth, substrate, and microorganism. First is the tooth or the host. Tooth morphology is recognized to be an important factor for the initiation of caries. Lack of enamel maturation or the presence of developmental defects in enamel may increase the risk. This may increase the risk. This can risk on plaque retention. Deep pits and fissure in the tooth make them susceptible to having caries because of food impaction and bacterial stagnation. The position of the tooth is one of the factors because if it's if a tooth is out of position or rotated or in an abnormal position, it is difficult to clean, hence retain more food and debris. That is why occlusal surface is more prone to having more caries kasi hindi inaabot masyado ng ating pagbabrush. Next is the substrate. Substrate can be a factor or of environmental issues, which is saliva. Saliva, the pH level, viscosity, the more acidic, the more susceptible in dental caries. And diet. This depends on the type of diet we have. The modern diet includes the refined foods, soft drinks that lead to collection of debris predisposing to more caries. The chemical nature of diet is it is where we are concerned with the nutrient present in the meals, frequently of intake, and also they are carcinogenic potentials. And lastly, microorganism. Microorganism, the most common microorganism that is associated with caries are the Streptococcus mutans and Lactobacillus. To prevent all of these factors, we should maintain our uh, diet uh, uh, and proper oral hygiene. And visit also your dentist at least 2 times a year. Thank you.